Hello and welcome back to the Stay Sure Wellbeing YouTube channel. I'm Dr. Dawn Harper and today I'm going to be talking about travelling with asthma. Asthma is a really common condition here in the UK. It affects around 1 in 10 children and 1 in 20 adults, but it shouldn't mean you can't go on holiday. It just might mean you need to plan a little more. Symptoms of asthma are a tight chest, a cough or wheeze or shortness of breath, and it's caused by narrowing of the airways that go into spasm when they're triggered by certain allergens or irritants. Common triggers include things like smoke, pollution, pet fur, cold weather, exercise, altitude, and pollen. So knowing your triggers may actually determine where you choose to go on holiday. For example, if you know that smoke is a problem for you, perhaps think about asking for a hotel room that you know is smoke-free. A lot of countries still allow smoking in hotel rooms. If pet fur is an issue, you might want to rent somewhere that you know never allows pets on the premises. And if pollution is a trigger, then perhaps think about going somewhere more rural rather than some of the highly polluted major cities around the globe. Most people with asthma should be able to travel to altitude without a problem, but if cold weather and exercise are triggers for you, then it may be that altitude could exacerbate your asthma and you might want to think about going somewhere closer to sea level. And pollen is a very common trigger. So if you know that you get asthma at certain times of the year and pollen is a trigger for you, then check the predicted pollen counts in your choice of destination, and that might determine what time of year you'd like to travel to that country. And of course, it depends what you want to do on holiday. If you want to go scuba diving, that isn't necessarily a no-no for somebody with asthma, but you will be required to fill a medical questionnaire with your doctor, and there may be a fee for that. But actually, I would suggest that you speak to your GP before you travel anyway. It's important that you take with you a letter confirming that you have asthma and that it lists the drugs you're on, both in trade and generic name, because we know that most drugs have different names in different countries. So it's important that your local destination knows exactly what you're on should you need extra supplies. With that in mind, I would always advise, and particularly at the moment during the pandemic, that you take extra supplies with you and you check that they are all in date. If your asthma is a little brittle and sometimes you need steroids or antibiotics, speak to your healthcare professional about potentially taking what we call a rescue package with you so that you have those medicines with you whilst you're away. I also think it's a good idea to learn a few phrases in the language to which you're travelling. Things like hospital, doctor, asthma, shortness of breath, inhaler. That might really help local people to help you should you get an asthmatic attack whilst you're away. And of course, anyone you're travelling with should know that you have asthma and know what to do in the case of an emergency. If you have very brittle asthma, you may find that the pressure changes in an air cabin could trigger your symptoms and you might need to travel with oxygen. In that scenario, of course, you will need a letter from your doctor and you will need to plan way ahead, or you may choose to travel another way other than by air. When you're travelling, make sure that you keep all your medication with you, preferably in the packaging in which you received it, because that then shows everybody exactly what it is. And whilst you're away, keep it with you as well, because you might be in unpredictable conditions and you may find that you get a trigger of symptoms that you weren't expecting, so always keep your inhalers close to hand. Wherever you choose to go, I hope you have a lovely holiday. Make sure that you take extra supplies, even more so this time because of the pandemic. We are seeing increasing numbers of lockdowns, increasing numbers of countries where returning requires quarantine, so make sure that you've got plenty of medication with you when you travel. Have a lovely time and stay safe. And of course, as always, please do let me know if there's anything you'd like me to talk about on this channel, any topics you'd like me to cover, any conditions that you have that you'd like specific advice about. Please message me here or email us anonymously on the website. We want this to be a really useful resource, so whatever you want me to talk about, I'm here to talk about it. But until then, stay safe.